Welcome back to the Doctor's Podcast, Health Tips Weekly, Episode 21. Does seeing a therapist really make a difference? On January 23rd, a heartbreaking news was reported. A 66-year-old man is believed to have resorted to taking his own life after feeling disheartened by a second COVID-19 positive test result and an allegedly hefty medical bill. Indeed, the impact of the COVID-19 pandemic has taken a great toll on many people's physical and psychological well-being. Malaysia has seen a rise in suicide cases or near-suicide cases during the pandemic, as prolonged uncertainties have put many under immense distress. Lockdown, economic downfall, losing jobs, domestic violence, grief of losing loved ones to the disease. These are only a few of the many sequelae of the pandemic, and they are crushing people every day. However, the deterioration of Malaysians' mental health precedes the arrival of COVID-19. The National Health and Morbidity Survey conducted in 2019 found that 2.3% of adults in Malaysia have depression, while 7.9% of children 5 to 15 years of age were found to have mental health problems, mainly due to poor interaction with their peers. Some experts believe that the numbers are likely to be underreported due to the stigma that surrounds mental health. Stigma surrounding mental health issues cause people to downplay them to mood swings, when in reality, what they need is professional help from counselors or psychologists. Destigmatizing mental health is not an easy task, but we can start by talking about it and embracing mental health as much as we do with our physical health. Mental health issues come in different forms and severities. People tend to link mental health issues to being crazy, and seeing a therapist means that you are close to being admitted into a mental health institution. This is not at all an accurate representation of the mental health issues most people struggle with. It is true that some mental health problems can be serious and pose threat to the sufferers themselves and people around them. However, the majority of the mental health issues Malaysians grapple with are way more subtle than that. They may behave perfectly normal on the outside but struggle with mental health problems. This is why detecting mental health issues is not as straightforward as physical health problems. In general, types of mental health issues in Malaysia include depression, anxiety disorders, eating disorders, personality disorders, bipolar, and schizophrenia. Each condition has its own set of unique symptoms, though symptoms often overlap. Some of the common warning signs of mental illness include feeling sad or withdrawn for more than 2 weeks, sudden overwhelming fear for no reason, sometimes with a difficulty in breathing and a racing heart, significant weight loss, or even weight gain. What comes into your mind when you think about treatments for mental health issues? Is it medications, a one-on-one talking session with a therapist, or perhaps electroconvulsive therapy? These are all treatments used for mental health issues, and they are often used in combination. Extraordinary advances have been made in the treatment of mental illness. As a result, many mental health disorders can now be treated nearly as successfully as physical health disorders. In today's episode, we focus on one modality of the mental health treatment called psychotherapy. Psychotherapy is commonly known as talk therapy. It is often depicted in pop cultures by people in certain movies or TV shows who talk about their past trauma and emotional difficulties with a trained and composed professional called the therapist. Besides the conventional heart-to-heart talk we often see, psychotherapy can also be conducted in an individual, family, couple, or group setting and can help both children as well as adults. There are in fact many problems that can be helped by psychotherapy, such as difficulties in coping with daily life, the impact of trauma, medical illness or loss, like the death of a loved one, and specific mental disorders like depression or anxiety. Mental health professionals use psychotherapy as a roadmap to understand clients and their problems and to develop solutions. There are 5 approaches to psychotherapy. Number 1 is psychoanalysis and psychodynamic techniques. This approach focuses on changing problematic behaviors, feelings, and thoughts by discovering their unconscious meanings and motivations. Number 2 is behavior therapy. This approach focuses on learning's role in both normal and abnormal behavior development. Number 3 is cognitive therapy. Cognitive therapy emphasizes what people think rather than what they do. Number 4 is humanistic therapy. This approach emphasizes people's capacity to make rational choices and develop to their maximum potential. Concern and respect for others are also important themes. Number 5 is integrative or holistic therapy. Many therapists don't tie themselves to any one approach. Instead, they blend elements from different approaches and tailor their treatment according to each client's needs. Psychotherapy can be provided by a number of different types of professionals, including psychiatrists, psychologists, licensed social workers, licensed professional counselors, licensed marriage and family therapists, psychiatric nurses, and others with specialized training in psychotherapy. Psychiatrists are also trained in medicine and are able to prescribe medications. However, have you ever wondered, does the scientific evidence support the use of psychotherapy? Well, many of our understanding about medical treatment is limited to the medicine that we ingest, and that is why many people are skeptical about the effectiveness of psychotherapy. The truth is that the evidence for the efficacy of psychological treatment is indisputable. A reanalysis on the effectiveness of psychotherapy for depression, published in 2018, reveals that psychotherapy for adult patients diagnosed with depression is effective. A systematic and critical review published in 2013 showed that psychotherapy is linked to positive changes in brain structure, in addition to improvements in patients' moods, beliefs, and behaviors. Cognitive behavioral therapy, a type of psychotherapy, is found to be beneficial for depression even when it is only delivered in the form of CD-ROM, DVD, or the internet. A good news during a pandemic where movement is limited. Nevertheless, scientific evidence shows that a combination of psychotherapy and medications is often the most effective approach in treating mental health issues, especially depression and anxiety. In some instances, the results produced by psychotherapy are often comparable to or better than the effects produced by medication treatments for the same disorders without the potential for harmful side effects that antidepressants often carry. So yes, seeing a therapist really does make a difference. If you think you would benefit from psychotherapy, how should you go about this? Surprisingly, it is easy to seek help for mental health issues in Malaysia. For starters, you can walk in any clinic kesihatan or government hospital for a mental health consultation first. Here we would like to mention Mentari. Pusat Kesihatan Mental Masyarakat is an initiative from the Ministry of Health to improve outreach and reintegration of people with mental health problems. However, it only receives patients who already visited mental health consultation at a government facility before. So you cannot walk in, but instead have to get a referral letter from a doctor at any government health facility first. Alternatively, you can also make an appointment at any private clinic or hospital for mental health consultation. The GPs or doctor will refer you to the appropriate facility for further evaluation and treatment. You can visit www.mentalhealth.my for more information. Don't feel ready to see a therapist in person just yet? Well, thanks to technology, you can also enjoy online psychotherapy at affordable rates. Some of the providers are Relate Malaysia, Malaysian Mental Health Association, who sets up a free emotional support program during this pandemic, Source Health, Mental Illness Awareness and Support Association. For non-psychotherapy related support services, you can benefit from Befrienders, which has a 24-hour 7-day suicide helpline at 03-7956-8145, or you can also email them at sam@befrienders.org.my. There's also the Women's Aid Organization, providing free and confidential services to survivors of domestic violence, rape, and other forms of violence. You can call them at 603-7956-3488 or SMS or WhatsApp them at 6018-9888-058. Remember, it is never too late to ask for help. When we talk about our feelings, they become less overwhelming, less upsetting, and less scary. Talk to Us wants you to know that your life's worth living. That's it for this week's episode. Until next time, stay safe and goodbye.